Hi, this is Professor Alfred Weaver in the Department of Computer Science at the University of Virginia. It's my great honor to be a co-guest editor, along with Renee Price, for the February issue of Computer Magazine. And today it's my pleasure to introduce you to Dr. Jing-Kwan Lee, who's an associate professor of computer information systems at Texas A&M University in San Antonio. Dr. Lee has a PhD in business administration from the University of Illinois at Urbana-Champaign, which happens to be my alma mater. He's been working in the area of data privacy for over 10 years, and today we're discussing his article entitled Electronic Personal Health Records and the Question of Privacy. And that is his article in the February issue of Computer. So, Dr. Lee, please tell us a bit more about your background, and I think in particular would like to know if you've had any personal experiences that have pulled you into this area where you are identifying and addressing privacy issues of personal health records.
Yeah, hi everyone. So basically, my research interests have been focused on, health information technology, data security and privacy, e-health and data mining. So when I was a graduate doctoral student, I already, basically take some kind of data mining courses from the Dr. Han, Jiawei Han. So actually, I did a very good, very interesting project in the privacy preserving data mining. So that after that, basically, I also conduct a dissertation research on this area. Try to develop some kind of techniques how to quantify the privacy. So basically, personal health record is basically increasingly recognized and used as a tool to have the consumers store and managing their own and their family's health information. I guess this is it's very important kind of trend, especially for the nationwide. We have a bigger kind of health problem. Like chronic disease. The health management basically, it's a very important area. So, but a lot kind of, personal health information is one of the most sensitive type of personal data. The most, important issue, also very kind of vaccine issue surrounding this PHR, personal health record, basically is privacy and security. So this actually recently, the Google Health actually have been closed because of, it's done track a lot of users. I guess the major concern is the privacy issue, So that's why I really, motivated to, conduct the research in this area. Try to, really, build some kind of good system. We can really solve some kind of very important problem for the nation. Try to, really, build some kind of privacy preserving, PHR system.
Okay. So speaking of these PHRs, or personal health records, could you give us some examples of the types of PHRs that you envision as becoming more popular in the next 5 years or so?
Yeah, basically, today's PHR system basically either tethered or untethered to a health organization. Maybe it's a health provider or health plan, So basically, a tethered PHR is just an extension of the traditional EMR system, electronic medical record system, So, but many kind of technology vendors, they provide untethered PHR systems, they are either web-based or device-based. So the very important, for the future of the PHR system, I guess, very important, it's largely depends on, how the vendors can make, health information easily available to the consumer. At the same time, they can protect their privacy, their security. Okay, so personally, I believe we can envision the privacy preserving hybrid PHR system will be getting increasingly popular. Typically, this kind of device, is a combination of the mobile devices with the PHR system.
Okay. In your article, you draw a strong distinction between the personal health record, the PHR, and the electronic medical record, the EMR. And you point out that while HIPAA covers the EMRs, that's not true of the PHRs. So what do you think is going to happen with these PHRs? Do you envision some policy changes that would protect them, and how long might it take to implement those changes?
So now, we have a federal law, basically once the Health Insurance Portability and Accountability Act, typically we call HIPAA. Another one basically is the Health Information Technology for Economic and Clinical Health Act, we call HITECH. So basically, those kind of two laws specify detailed rules, the security and the privacy rules applied only to the, entities of the health plans, healthcare clearing houses and healthcare providers, but they are not, applied to PHR vendors or their business partners. So far, the PHR vendors are basically bound only by the, FTC, Federal Trade Commission's breach notification rule. So a lot of consumers just will never comfortable with, the whole idea of a digital medical record if they don't trust the system is not protected by the federal laws. Although, the vendors, they can promise a lot, they want to keep the privacy, they want to keep everything secure, private. But, with consumers expect the policymakers can extend the HIPAA or HITECH provisions or penalties to the PHR vendors. But we don't know how long does it take. But essentially, if the PHR system is getting popular, this will happen. Okay.
Okay. All right. So digging down just a little more about those EMRs, back in 2009, President Obama established billions of dollars as incentives for hospitals and clinicians to use the health information technology that would include EMRs. What do you think has happened in these last 5 years on that front?
So one kind of bigger progress, we make in healthcare, basically, this also benefit, from that benefit from the American Recovery and Reinvestment Act. Basically, the bigger kind of progress, basically the widespread use and adoption of the electronic medical record. You can see a lot of My Doctor, many kind of doctors, they actually pass stage 1, stage 2. They widely use electronic medical record. This actually significantly improves the patient care and reduce the medical errors. So in addition, some kind of EMR system also allow patients to directly access or download their medical record to maybe to a USB drive, to their other kind, maybe to the PHR vendors, like the Microsoft Health Vault, So basically, this PHR, even more kind of important than EMR. Why? The EMR just a doctor notes. Now PHR actually contains the patient generated contents. Everyone just have one life. People increasingly realize the importance of health. They want to monitor their health, especially for a lot of chronic ill patients. So the idea is, if we can use technology to build very good kind of PHR system, I hope in the future, everyone can keep their lifelong health record, secure and private. They can manage their life. They can improve their life. They can prevent a lot of chronic disease like diabetes, obesity, cancer. So this is very, very important for the nation. Reduce the health care cost. Also improve the people's quality of life.
Okay.
So
go ahead.
So basically, research must be address both the technical and the legal challenges, try to prevent unauthorized PHR access and uses. We need, as a researcher, especially from the computer science side, from other kind of field, we need to really, develop good kind of system for the user to use.
Okay. Well, I think you've already answered the next question I was going to ask you, which was what part of this problem do the technologists need to pay close attention to? And I think you just answered that question. So here's my last one. In your article, you state that vendors have to balance sufficient return on investment, which is classic, with a mechanism for protecting consumer privacy. And as always, cost is an issue. But could you give us a real-world example of the kind of balancing that you refer to?
Yeah, basically that's a very, very good question. A critical issue for the PHR research, is how we can, how to align the PHR vendors, commercial interest and the incentive for the protecting the privacy of the PHR data. So now we don't have very good kind of system we can trust. So but we have some kind of emerging kind of like a health record bank. Maybe we can use that as an example. I guess in the state of Washington, they actually they try to build out the first generation health record bank, for the consumers. So why this kind of model, maybe this kind of emerging web-based health record bank represent the future of the PHR, because they on the one hand they provide a consumer private and a secure place to keep their health record while maintaining their financial kind of sustainability. So basically, it's more like you have some kind of many banking account. We can basically deposit, withdraw, transfer the health record from one bank to another bank. Also, they also provided develop viable, sustainable business model. Why? Because if we have a lot of health record, a lot of profiles, they provided very good resources for the secondary use by the commercial and the research enterprises. Especially after we de-identify the data, do the basically, many kind of privacy laws in basically allow the disclosure of the health data, for the secondary uses, if the data is de-identified. So in that case, we can use the data to allow kind of de-identified data, for allow kind of very good kind of greater use of society, like population health research, the comparative effective research, drug side effect research. We can do a lot of very good things, while at the same time we can maintain the privacy of the PHR because we use the very reliable kind of de-identification algorithm to preserve the privacy. So I guess, the privacy is not a kind of barrier or impediment to the PHR system, just an enabler. We can collect a lot of people's profile, health profile. This actually very important for the, the a lot of significant scientific research.
Okay, well, thank you so much for your time. We appreciate being able to interview you and learn some more about the ideas behind your article. For our thanks here to Dr. Jingquan Li. We appreciate your time and your talent here for explaining to us a bit more about your paper. Thanks very much.
Yeah, my
Goodbye.
pleasure. I really appreciate that.